Thank you very much, Fabio, and welcome everyone to our webinar today on antimicrobial resistance. We also would like through the webinar to promote the course on antimicrobial resistance, and I wanted to underline that the course and the webinar is not only an FAO product, it is also the result of a collaborative effort involving 3 other institutions. So our partners in this endeavor are the Center for Environment, Fisheries and Aquaculture Science, the Veterinary Medicine Directorate, and the Animal Plant Health Agency. So the objective of the webinar today is to try to understand together what is antimicrobial resistance, why is it becoming a challenge globally for global health, and also how can we together try to minimize the impact of antimicrobial resistance, and also very importantly is how can all the actors and various stakeholders involved along the food value chains, how can we involve them all to try to limit antimicrobial resistance? So I would like now to give the floor, and we are very pleased to have with us today my colleague Keith Sampson, who is the FAO Chief's Veterinary Officer. He's also the leader of the Animal Health Program and also the director of the Joint Center for Zoonosis and Antimicrobial Resistance. Keith, the floor is yours. You have 5 minutes for the introductory remarks. Thank you.
Thank you, Christina, and thanks everyone for coming here today. Antimicrobial resistance really affects all of us. It'll affect all of us in our lives in one way or another. It's a problem we cannot ignore, and it's one which we all have responsibilities in. So it's great to see that we've got this launch event for FAO's AMR e-learning course. The supporting countries and their food and agriculture stakeholders through the value chain to build their capacities and competencies to address AMR is within FAO's mandate. Indeed, we have to do it. Resistance is growing, including in the area of parasite resistance, affecting our producers in livestock, but also affecting plant health. Remote education opportunities, e-learning, have become increasingly the way to go, particularly as we've seen. It brings us together, it enables us to meet, it enables us to work, and it enables us to train in a new way. So it's great to see that we've got this new online tool. This is the first of FAO's courses on AMR to be made online, and there's been a very high demand for it. We see this as beginning of something for which we will need to produce many more courses appropriate to the different competencies that are required, the different information needed, the different decision makers in our many sectors. So the first course will provide an overview of AMR from the agri-food and environmental perspective, considering the role of various food and agriculture sectors and the impacts of AMR. Really like to thank our partners that have been mentioned already, who've made this possible to do this work. And this webinar itself provides a brief technical background on AMR. We hope that it will encourage participants to use this course. We intend to use it in FAO wherever we are working with countries, wherever we are starting new projects and support, and we would encourage you also to make use of it if it meets your needs. So the feedback on it will be helpful to improve it for the future. Thank you very much.
Thank you very much, Keith. And I would like now to give the floor to my colleague Jungxia Song, who is the Senior Animal Health Officer in FAO. So Jungxia, the floor is yours. You have about 10 minutes. Thank you.
Thank you, Christina. I will put on my slides. Just a moment.
Yes.
Did you see my slides?
Yes, everything okay.
Okay, thank you. Good morning, good afternoon, good evening, dear participants. I'm glad to be here to join this very important topic. Antimicrobial resistance is a major global threat to human, animal, plant health, it also has implications for food safety, food security, and the livelihoods of millions of farming households. Any use of antimicrobials could drive resistance. Misuse and overuse will accelerate the development of resistance. Based on some studies, more than 70% of the antimicrobials are used in animals raised for food. Residues of antimicrobials could present in milk, meat, eggs, may spread into environment, contaminating soil and water. AMR is reducing the effectiveness of antimicrobials, compromising the treatment of infectious disease, both in humans and animals. Recent studies found that AMR caused 1.27 million human deaths in 2019, and that could reach 10 million per year by 2015. AMR is a leading cause of death around the world, with the highest burden in low resource settings. If the problem is not addressed, the cost in terms of global production, the lost global production between now and 2015 would be an enormous $100 trillion if we do not take any action. So in 2015, FAO's 39 conference adopted a resolution on AMR, which recognized it poses increasing serious threats to public health and sustainable food production. So FAO developed an action plan on AMR in supporting governments, producers, traders, and other stakeholders to move towards the responsible use of antimicrobials in agri-food system, therefore helping reduce the need of antimicrobials in food and agriculture sectors. FAO action plan on AMR from 2021 to 2025 was adopted by Council last year. It highlighted 5 action pillars. Number 1, increasing stakeholders' awareness and engagement to foster change. Number 2, strengthening surveillance and research. Number 3, enable good practices for infection prevention and control. Number 4, promoting responsible use of antimicrobials. Number 5, strengthening governance and allocating resources sustainably. The FAO action is fully in alignment with the Global Action Plan on AMR, supporting the implementation of national action plans. In terms of national action plans, according to the latest tripartite questionnaire, 136 countries have developed their national action plans by 2021, which is a significant progress. But a big gap in the implementation of these national action plans, particularly in food and agriculture sectors. For example, certain countries in their action plan didn't cover responsible use of antimicrobials in animal sector, and 45 countries covers just the limited aspects on responsible use in animal sectors. 83 countries didn't cover good agriculture practices in their national action plans. Under FAO's action plan, a set of tools has been developed to support our members. For example, FAO Progressive Pathway for AMR is applied in 19 countries, situational analysis tool in 13 countries, assessment tool for laboratory and surveillance system, FAO Atlas, in 28 countries, legal methodology to analyze AMR-related legislation already applied in 22 countries. This tool will be expanded to One Health tool. Field interventions is essential. Stakeholder for example, stakeholder assessment at local level, and through farmer field school, catalyzing the behavior change, One Health approaches for antimicrobial stewardship. So given the situation COVID, how FAO best support the field interventions? The e-learning can really play a significant role to deliver such guidance and intervention for the national capacity building to manage the issue related to AMR through e-learning, and the support could reach to all the places. So the new courses was developed upon the growing demand from the food and agriculture sectors stakeholders. It offers an overview of antimicrobial resistance as a global threat to human, animal, environment health. It explains the roles of food agriculture sectors and the impact of AMR on agri-food system, It also describes how FAO is contributing to increased awareness and engagement of all stakeholders in the food and agriculture sectors to tackle AMR. The introduction module just published, it will help to understand AMR within the food and agriculture environment, and it is the first step to expand the knowledge of the users on the AMR response. The courses consist of 5 lessons ranging from 30 to 40 minutes duration each. Number 1, what is antimicrobial resistance and what is global public health challenge? Lesson 2, antimicrobial resistance in the context of One Health. Lesson 3, the role of food and agriculture stakeholders in antimicrobial resistance. Lesson 4, how can antimicrobial resistance can be contained and its impact minimized in food and agriculture. Lesson 5, the role and current initiative of FAO in tackling antimicrobial resistance. The course is designed for broader stakeholders with the role and interest in antimicrobial resistance in agri-food system, including producers, the wholesale and the retail distributors of antimicrobials, expansion and veterinary services, epidemiologists, laboratory personnel, academia, including students. So after completing the course, learners will receive a digital certification from the FAO e-learning center. So this FAO in collaboration with our reference center in UK developed this course. The course quality was assured both internally and externally. Internally, it was done by FAO AMR working group. Externally, FAO AMR reference center network really provided huge support. FAO will continue to produce new courses to meet the demand from countries and food and agriculture stakeholders. Currently, we have a pool of identified topics under the 5 pillars of FAO action plan that could support the countries to tackle AMR, and we also welcome any topics proposed by our partners and stakeholders. FAO AMR will provide a series of e-learning courses and in the future with the lessons learned from this development of this introduction module. And the AMR e-learning webpage will be established very soon. It will be a to-go place to find the e-learning courses from FAO and its partners and create a community to share the experiences and the region across the regions. FAO is established the virtual learning centers in regions. The virtual learning centers are learning hubs based on FAO regions and sub-regions with the main objective of providing training to different professionals to meet countries' need and FAO objective. By using information and communication technology to deliver and cascade courses and resources, the VLCs allow ample and geographically different audience to be trained in an economic and environment-friendly manner. Virtual networking allows colleagues in distant locations to easily share experiences with those they might otherwise never met. Mobile-first solution are virtual learning center approaches that ensure courses content is easily visualized from the mobile device, even with poor internet connection. So this e-learning academy and the virtual learning centers would be the main platform to support AMR e-learning delivery. I'll stop there. Thank you very much. Back to you, Christina.
Thank you, Jung-Sai. And I would like to take this opportunity, since we have a few minutes, to give a bit more information about the certification, because we have noticed that ever since the FAO e-learning academy has started with the certification, there has been a huge increase also in the learners throughout the world. So I wanted to mention that it's a certificate of competences that we are releasing. So after finalizing the course, there is a scenario-based, competency-based final test. And if the learner basically passes the test, then you obtain this digital badge certification, which can follow you in your e-portfolio, in your CV, in your LinkedIn. It becomes part of your pool of competences. So this was just to provide a bit more information about the certification. I'd like now to give the floor to Rachel Belton, who is the co-lead of the UK FAO Reference Center for Antimicrobial Resistance and the International Project Manager at the UK Veterinary Medicine Directorate, who are our main partners in this. So Rachel, the floor is yours. You have about 15 minutes. Thank you.
Thank you, Christina. I'll just share my screen and hopefully you can hear me okay as well. Sorry, it would be a second. Let's just move this. So hopefully you can see my screen.
Yes.
If my colleagues could let me know if not.
Yes, everything
brilliant.
Okay.
Brilliant, thank you very much. So good morning, good afternoon, wherever you are in the world. We're really happy to have you here on this webinar. My name is Dr. Rachel Dalton. As Christina has already introduced me, I'm an international project manager at the Veterinary Medicines Directorate, which is part of the UK Department for the Environment, Food and Rural Affairs, or DEFRA, as it's known. I was heavily involved in the creation and design of the course in collaboration with my colleagues at the FAO and across the UK government. And so the purpose of my presentation will be just to give you a brief introduction to the antimicrobial resistance and give a snapshot of some of the material that the course contains that you can access online. So I'll be presenting today as a co-lead of the UK FAO Reference Centre for Antimicrobial Resistance, which is a collaboration between 3 agencies that are listed at the top of this slide. So I represent the Veterinary Medicines Directorate, which is the one in the middle. And I've also listed the contact details of the UK Reference Centre at the bottom there, should you wish to get in touch with us afterwards as well. So I'm just going to provide a brief background and context to our involvement in this project with the FAO. We've been delighted to collaborate with the FAO team over the last 9 months to a year in the creation of this course. So I'll describe the role of the UK FAO Reference Centre for Antimicrobial Resistance. And this reference centre is a collaboration between 3 organisations across the UK Department for the Environment, and that is the Animal and Plant Health Agency, CFAS, so the Centre for the Environment, Fisheries and Aquaculture Science, and the Veterinary Medicines Directorate, which I'm representing today. And together, the expertise of AMR across these 3 agencies is designated by the FAO as a reference centre for antimicrobial resistance. And the purpose of the reference centre is to support the organisation's work on combating AMR across sectors in food and agriculture around the world. And that includes the creation of virtual learning resources, such as the e-learning course that we're discussing today. And on the left here, you can see the areas of the action plan of FAO on AMR, which Jean-Charles has just previously mentioned as well. So just moving on briefly, who are the Veterinary Medicines Directorate? So we are an executive agency of DEFRA, the Department for the Environment, as our parent government department. And as discussed on the previous slide, we're one of the 3 organisations that form the UK FAO Reference Centre for AMR alongside our colleagues in other government departments. So at the VMD, we work to promote the animal health and welfare through ensuring the safe, quality and efficacy of veterinary medicines, including antimicrobials, as the UK Veterinary Medicines Regulator. Part of our role is as the policy lead for antimicrobial resistance in animal health, and we work to advise the UK government and collaborate with international partners on combating AMR, and that includes the FAO in the creation of this course. The VMD also supports the implementation of the UK 5-year National Action Plan for AMR, and in collaboration with other government departments, such as the Animal and Plant Health Agency, we also lead on the publication of the Veterinary Antimicrobial Resistance and Surveillance Report, or the VARS report for short. And this report monitors veterinary antibiotic sales and antibiotic resistance in bacteria from food-producing animals in the UK. So if anyone is interested in learning more about the VARS report, we will put that in the chat box later on, so you can access it after this presentation. So moving on from the background and context, the objectives of this presentation will answer 3 questions that are central to the e-learning course that we're introducing today. So firstly, what is an antimicrobial? Secondly, what are antimicrobials used for? And finally, what is antimicrobial resistance, or AMR for short? And these 3 questions are specifically covered in lesson 1 and lesson 3 of the e-learning course, which goes into further detail on these topics. So if we start with our first question, what is an antimicrobial? And this question is covered in greater detail in lesson 1 of the course. An antimicrobial is any substance that is able to inhibit the growth of a microorganism or destroy it completely. And when we refer to antimicrobials in the e-learning course, and perhaps more generally when antimicrobials are referred to in webinars or literature, usually we're referring to antimicrobials as medicines, and medicines which can be used to treat and prevent infectious diseases caused by microorganisms, and these include bacteria, viruses, fungi, and protozoan parasites, and all of these cause infections in humans, animals, and plants, which we sometimes need to treat and resolve. I think it's important to note at this point that an antimicrobial is any substance that is able to stop the growth or kill microorganisms. So that means that it isn't just limited to medications, but lots of different things constitute an antimicrobial. And examples of these are disinfectants and pesticides, which can also be used as antimicrobial agents. An example of this could be an antimicrobial disinfectant, which is often used as the primary option to kill microorganisms on surfaces in healthcare facilities to stop healthcare associated infections. And again, antimicrobial disinfectants are widely used across food and agricultural sectors to ensure food quality and safety. Similarly, pesticides, so some pesticides are classed as antimicrobials as they kill or stop the growth of microorganisms, and pesticides can be used in plant production and cropping systems as well, which lesson 3 goes into more detail on. It's also important to recognise that the term antimicrobial is an umbrella term, and this means that it covers everything that tackles the growth or kills bacteria, viruses, fungi, and protozoan parasites as well. So this means that it could be including antibiotics, antibiotic medicines treating a bacterial infection, to an antiparasitic medication, which is used in cases of parasites, as well as antiviral or antifungal medications. This means that antimicrobial, the term antimicrobial, is much broader than the term antibiotic, which is solely concerned with the presentation and treatment of bacteria, and therefore it's a narrower term. But it's important to understand the difference because sometimes these terms can be used inadvertently, interchangeably, and they are quite different. So to summarise the first question, so antimicrobials are substances that are able to stop the growth of and kill microorganisms. In the context of this e-learning course and presentation, we're talking about antimicrobials medicines that are used to treat and prevent bacterial, fungal, viral and parasitic infections in humans, animals and plants. So we'll move on to our second question, which is what are antimicrobials used for? And now we've defined an antimicrobial, we can move on to answering this question. So as the FAO e-learning course is an introduction to antimicrobial resistance in food and agriculture specifically, I'm going to focus on uses of antimicrobials in the animal sector, but it's, of course, antimicrobials are used across many sectors, plant production and protection being one, human health as well, and they're used in very similar ways. So this second question is covered in greater detail in lesson 1 and lesson 3 of the course, and it also includes more detail on antimicrobial use in plant-based agricultural sectors as well, if you're interested in that. So use of antimicrobials is usually, antimicrobial medicines is usually for the prevention, control and treatment of disease in individual animals or groups of animals. And these could be food producing animals, but they also can be domestic or companion animals and wildlife populations too. So it's important not to forget them. So when antimicrobials are used within a veterinary medicine context, the use of antimicrobials can be roughly divided into 3 categories. So starting with treatment, so treatment when an animal or a group of animals is showing clinical signs of an infectious disease. Antimicrobials medicines can also be used in the control. So when an antimicrobial is administered to a group of animals, some of which are infected, some of which are healthy, to try and minimize the spread of a disease and resolve the disease in the infected animals. Or it can be used in prevention. So when an antimicrobial is given to a healthy animal or groups of animals that are at risk of a specific infection, or perhaps they're in a certain situation or environment where an infectious disease is likely to occur. And an example of this could be due to a high stocking density in inappropriate housing, which could exacerbate the likelihood of contracting an infectious disease. So antimicrobials are also used across the animal sector in lots of other ways, but there is a second use which I wanted to mention, which is non-veterinary medical use of antimicrobials for growth promotion within food producing animals specifically. So this process intends to increase the rate of weight gain and improve feed utilization, and it also reduces the morbidity and mortality of animals, which could interfere with growth by preventing the diseases in those groups of animals. Now, the use of antimicrobials as growth promoters in food producing animals and agriculture is contested, and different countries take different approaches to this. So currently the use of antimicrobials as growth promoters is banned here in the UK, where I'm based, and across the UK and across the EU, sorry. And WHO, FAO and OIE, the Organisation for Animal Health, World Animal Health, call for the phasing out of use of antimicrobials for growth promotion. Now, one of the reasons for this, which isn't the only reason, but an important one for this opposition to use of antimicrobials as growth promoters, is due to antimicrobial resistance, which is obviously the focus of this FAO e-learning course and of our webinar today. So we can move on to our third question, which is, what is antimicrobial resistance? So we've defined an antimicrobial and what they're used for. It's important to define antimicrobial resistance and why this is a public health challenge, which can be found in lesson 1. So antimicrobial resistance, or AMR as it is shortened to, is the ability of microorganisms to persist or grow in the presence of substances that are designed to inhibit them. And microorganisms, whether that is a bacteria, virus, parasite, or fungus, microorganisms, whether that is bacteria, fungus, virus, etc., have the ability to persist or grow despite the presence of that substance, which could be a medicine, pesticide, etc., which we've already mentioned. It's important to understand that antimicrobial resistance is a naturally occurring process, but it can be exacerbated or increased, worsened, etc., when antimicrobials are used excessively or inappropriately, such as in the wrong context. And an example of this could be giving the wrong antimicrobial drug to treat an infectious disease, so giving an antibiotic when actually the disease process is a virus and it's ineffective. And these can create conditions that lead to the growth of antimicrobial resistance. And the consequences of antimicrobial resistance when a microorganism becomes resistant to, let's say, an antimicrobial drug, pardon me, treatments of diseases fail, and this has severe consequences. So this means that infections that were once easily treatable become incurable and patients can die. And in food and agriculture, this has massive implications, as Jean-Cher has already mentioned. Resistant animal diseases lead to negative impacts for animal health, animal welfare. It also is massively disruptive to food security and farmer livelihoods, and it is one of the leading causes of death in human health around the world. So to prevent or slow the growth of antimicrobial resistance, the FAO, WHO and OIE recommend reserving antimicrobials for use in exceptional cases where risk of infection is likely to be severe and with severe consequences. And there is lots of ways to tackle and combat antimicrobial resistance, and some of these ways my colleague Fraser Broadfoot will be covering in the next presentation. Some of these ways are also covered in the national action plans, which have been developed on an individual country basis, and also the FAO action plan, which I'm sure we can put in the chat if you want to find out more about that. So to summarise, in this presentation, we've covered what antimicrobial is, what antimicrobials are used for, specifically within the use in food and agriculture. And we've also defined what antimicrobial resistance is a very brief introduction to the content of the e-learning course that we're introducing today. So all of that content is available through the FAO e-learning Academy website, and it goes into greater detail on each topic. So please do access that course if you haven't already. Finally, I'd just like to conclude the presentation. It's been a pleasure and a delight to be collaborating with the FAO on this project, and I look forward to answering some of your questions at the Q&A at the end of the session. Thank you.
Thank you very much, Rachel. I'd like now to give the floor to Fraser Broadfoot, who is the head of the antibiotic use surveillance and stewardship team within AMR department at UK Veterinary Medicines Directorate. So Fraser, the floor is yours. You have 15 minutes.
Thank you very much. I'm just going to share my screen and hope that will work. Okay.
Works well.
It works well. Yep,
Yes.
Good. That's good. Good to know. We are struggling a bit this morning, so good. I'm glad that's working well. So yeah, thank you. So for the next 15 minutes, excuse me, I'm going to be talking about how you can develop a collaborative approach to reducing antibiotic use. And I'm going to be using, I come from the, as the introduction said, I work in the United Kingdom. So I am going to be using the UK as an example, and how we developed this kind of collaborative approach to AMR. I know that the approach we took is not necessarily right for everyone, and globally there are lots and lots of different ways that countries are tackling AMR. But I think that by going through our approach, it does highlight some key principles that I think are common to everyone who's working on AMR, and certainly that are a big focus of this e-learning platform as well, and that is collaboration. So making sure everyone's working together. The importance of data in driving improvements in AMR, as well as the importance in focusing on preventing disease and reducing the need to treat with antibiotics in the first place. So that's the key focus of this presentation. So I'm going to start by just giving you a little bit of a timeline as to the UK situation. So I'm going to go back to 2013. Now, certainly AMR has been a key policy focus for the UK government for a while, and but 2013 was an important year because it was when the first One Health AMR strategy was published, and this was the first time that we'd brought together the human health side, the animal health side, as well as the environmental side. At around that time, there was quite a lot of media pressure on, particularly on farming sectors, talking about the antibiotic use in the farming sectors, and it was often quite critical. And this has the effect of making people in the farming sector naturally and quite defensive and wanting to kind of defend how they're using antibiotics. And there was this kind of blaming going on where maybe the human sector was blaming the farming sector, the animal sector was blaming the human sector. And so I think by developing a One Health strategy was at least the first step in helping to reinforce that it's a joint responsibility. Both the human and the animal side play a part in dealing with AMR, and you know, it's better if they work together with a feeling of mutual respect. And just one very simple thing that happened as well in the UK is that some of the human people on the human side who were kind of criticizing the animal side, and as well as the chief medical officer, they were all invited to go around a pig farm. I know it seems quite a simple thing, but even just something like that helps some of the people on the human side to better understand you know, farming practices and what actually goes on in farms, and to try and, you know, build a closer relationship. So even something as simple as that really helped. Another key thing was because the chief medical officer in particular was very proactive on AMR, and convinced the Prime Minister to produce this independent review on antimicrobial resistance, and that was commissioned in 2014. Also in 2015, antimicrobial resistance was added to the UK National Risk Register, and this is a list of things that are kind of major issues, you know, for example, alongside the likes of climate change and other major risks that the country are facing in the future. So by adding AMR to the National Risk Register meant that suddenly it drove some of these kind of increased political commitment as well. And then the independent review was published, and following the independent review being published, the government committed to a number of actions on AMR, and one of them that I'm going to talk about later was asking the sectors to develop their own targets for improving responsible use of antibiotics, and I'll talk more about that later in the presentation. So as well as putting it high on the strategic importance, and another important area is really important area is data. I mean, this is the area that I work in and lead on, is trying to get better data, antibiotic sales and usage data. The UK has been collecting antibiotic sales data since 1993, and this comes from the pharmaceutical companies, so the marketing authorization holders, and they send us everything that they've sold, which is extremely helpful. However, one of the limitations of that is shown on this slide. So you can see this is a table showing tons of antibiotic, and then on the left hand side it shows what species those antibiotics, where we've had antibiotic sales, what species those products are indicated for. So the problem with just having sales data is that a lot of products are indicated for more than one species, and I've highlighted the pig and poultry ones here. And looking at this table, you would say, well, there's quite a lot of use in pig and poultry, but there's absolutely no way we can split and know how much of that is going into pigs and how much of that is going into poultry. And so for that, we need usage data, which can either be obtained from the farm, or usage data can also be obtained from what's delivered to the farm, for example, maybe from feed mills, or what's prescribed to be onto the farm, for example, by the vet. But as long as you can split it by species, then it's generally considered usage data, whereas sales data you cannot split by species. And in the UK, it was the British Poultry Council that really took the lead in getting antibiotic usage data. So the British Poultry Council represent 90% of the meat poultry sector in the UK, and they really wanted to know what was being used in poultry, because they were putting into place control measures to improve antibiotic stewardship, and they wanted to know what was the effect of those measures, and they also wanted to protect the reputation of the sector as well. So they put together a system where they collected antibiotic usage data from the producers and from the farmers, and this was then, I'm showing you now what was published in 2015, and this is looking again at tons of antibiotic active ingredients. So what you can see is that there was a significant reduction. If you compare 2012 with 2015 and 2014, you can see that there was a really significant reduction in antibiotic use, and that really showed to the British Poultry Council that the measures they were putting in place were effective, which is important. But what it also did was it stimulated some of the other sectors to collect their own data as well. And so the pig sector developed their 2016. They developed their own stewardship program, and that what I mean by stewardship group is when they get together the vets, the farmers, the feed companies, basically all the people who are maybe who are interested, maybe some university specialists. So all the key people who are able to drive change in the sector and have an interest in antibiotic stewardship. So the pig sector formed their own stewardship group, and they also developed their own data collection system, which was an electronic system called the Medicines Book, where the farmers, every 3 months, the farmers have to record their antibiotic usage data. And this also became a requirement under some of the farm assurance schemes. Now, these are schemes that farms have to be part of in order to sell into some of the major retailers. And so that really meant that 95% of pig production is now recorded. Antibiotic use is now recorded in this system. And this is all through, this is not a legislative requirement, but it's through some of these voluntary farm assurance schemes. And what happened then is that with the poultry sector and the pig sector publishing data and demonstrating the benefits of publishing data, then a lot of the other sectors then started getting on board. So you can see that there was data now. If you look at our annual report now, we have data from laying hens, we have data from game birds, we have data from salmon and trout. We have struggled a bit to get data from sheep and cattle, but they have now launched a medicine hub to really collect all the data for cattle and sheep as well. So I think once one or two sectors start collecting this data, it does create a momentum, and we start seeing a lot of all the other sectors wanting to get this data too, which I think is good. And one of the real benefits that the pig sector have found is in terms of benchmarking their antibiotic use. So the pig sector have, this isn't real data, but this shows you the kind of thing that the farmers and the vets see when they log on to the medicine book. So on the bottom, you can see the different bands that represent what, using a measure called milligrams per kilogram, and that's relates to the milligrams is the amount of antibiotic active ingredient, and then kilograms relates to the weight of the animal population. So you can see along the bottom there these bands of 0 to 10, 10 to 20 milligrams per kilograms, and then on the left is the percentage of farms that are within those bands. So if you were this farm, this is pretend data, but if you were this farm, then you would say my usage is 63 milligrams per kilogram. The average usage for farms within that particular farm type, because you've always got to compare one farm with a similar farm type, but the average usage for that category is 31. So then you would say, well, actually, my use is over double the average. That's the mean. And so this is a real stimulus. It really helps the vets talk about antibiotic use with the farmers. It helps the vets and the farmers to recognize whether they are a high user, and it also helps some of these persistently high users to the vets can work with them to improve how they're using antibiotic use, helps them understand how they're using antibiotics and discuss how things can be improved. So benchmarking has proved to be a really, really useful thing, and that's currently employed by the pig sector, and it will soon be employed with the cattle medicine book as well. So that's the importance of data. And now the next part I wanted to talk about was the importance of targets and getting the sectors to work together. So in the UK, we have this organization called RUMA, which stands for Responsible Use of Medicines Alliance. And this is an industry organization that works with lots of different sectors within lots of different food animal sectors. So in 2015, they had planned to create this task force where they'd bring together members from the different food animal sectors to talk about antibiotic use. But following this independent review that the government published, we asked, as the government, we asked the sectors to create their own sector specific targets. And so RUMA, once we asked the sectors to do that, then RUMA came together and said, well, this we can use our task force to develop these targets. And the task force consists, as well as having observers from government, the task force consists of a vet, and it consists of a farmer from each of the main livestock sectors, and they all sit together in a room. And the idea is that they share experiences, they share ideas, they learn from each other basically and support each other. But then once they have these meetings, they then liaise with their wider sector through some of these sector stewardship groups to actually develop the targets. And importantly, the targets themselves, the idea of the targets is that they were broad in scope. So they weren't just, we will reduce by this much, but there were also targets around, what are the key area hotspots for antibiotic use in that sector. There were targets around improving training, improving vaccination, improving disease prevention measures, getting better data, which is an important target for some sectors. And so the first set of targets was published in 2017, and then the second set of targets was then published in 2020, which covers the period up to 2024. So I think this was a really important initiative, and what we've seen in the UK is that we have seen some very significant reductions in antibiotic use. So we've had a 52% reduction since 2014, and as you can see from that graph, a lot of that happened between 2014 and 2018, and I think the data collection and the target setting and the collaboration have really contributed to the reductions that we've seen. So if we move on to the e-learning session, I think hopefully the e-learning session will prove to be really useful. A lot of the elements within session 3 and session 4 relate to what I've talked about already. So session 3 is very much focused on how you can develop a proactive approach towards reducing antibiotic use. So creating health and welfare plans that aren't just focused on treating existing diseases, but are focused on the long-term and medium to long-term disease prevention, and these are usually developed by the vet alongside the farmer. So that's discussed within session 3, and you can see all these different areas. If you click on them, then you can get more information on the training. The training also covers the importance of record keeping, and that includes the recording of antibiotic use, but also monitoring health and welfare of the animals on the farm as well, which is vitally important. And then session 3 also talks a lot about antibiotic use and benchmarking. And as you can see on here, if you click on any of those yellow boxes, then you get a lot more information as well. So so the training, the e-learning will go into a lot more detail on the concepts that I've discussed. Session 4 also talks about the importance of antibiotic stewardship groups. I've mentioned that in the UK we have species and sector stewardship groups. It's also important to have, you can also have One Health groups bringing the human and animal sector together, and retailer stewardship groups, and individual vet practices and individual farm businesses can also create their own antibiotic stewardship groups as well. And then importantly, the session 4 is very much focused on disease prevention and preventing the need to treat with antibiotics in the first place. So it talks about a lot of detail about improving husbandry, improving biosecurity to stop diseases getting onto farms, or to stop diseases spreading once they get on, if they get onto the farm. That's internal biosecurity as opposed to external biosecurity, which is stopping the diseases getting onto the farm. And it also talks about vaccination as well, and the importance of vaccination. So so the other good thing about these sessions, both the sessions, is that they include specific examples. So there are species sector examples. So we see here pigs I'm showing, but there's examples from different sectors too. And there are also country examples. So I put here a box up showing biosecurity in Indonesia. So that there's lots of good examples throughout the whole training. So I think it's really useful. So just to finish off, I think I've got 3 minutes. I think I've just about got enough time. So just to finish off, to conclude on what are the key factors for success, certainly for the UK, and I think some of these are common factors that other countries will find as well. So certainly strong leadership is important, and that includes leadership from the government, but also leadership from the sectors. And certainly in the UK, we have had strong leadership from sectors like the pig sector and the poultry sector, as I've explained during this presentation. Having a collective approach with accountability is really important, and in the UK, with the sectors themselves setting their own targets, creating their own stakeholder groups, collecting their own data, then it really means that they develop a sense of kind of ownership of the issue, a sense of accountability and responsibility, and it feels like they're working together to deal with the issue rather than feeling like they're being forced to do something. Having cross-sector organisations to lead on the work has been very helpful. I've talked about the RUMA, which is a cross-sector organisation which has brought the different sectors together. Also, some of the farm assurance schemes like Red Tractor is a cross-sector farm assurance scheme, and they've helped to drive some of this change as well. Having good relationships between the farmers and the vets is absolutely vital, and actually some of the sectors where there's been the most progress are probably the sectors where they have the strongest relationships between the vets and the farmers. So so that is absolutely key. Vets really are the gatekeepers for antibiotic use. Having government and livestock vets working together, we've worked hard to build trust with the livestock sectors, and I think this is aided by the kind of voluntary approach. It doesn't feel like it's being imposed upon them. They're actually working they're realizing it's an important issue. The sector targets, I think, is really important. I think by setting targets themselves, that they've been able to have greater buy-in. I think it's challenging. Some of the sectors which don't have as good data, it's harder for them to set targets, and so in some of those sectors, the targets were around getting better data, which is still important. So yeah, monitoring targets, access to data. Having data means you can monitor the target, you can see how well you're doing, you can monitor your progress towards developing the targets, and also you can benchmark use, which is what I showed for the pig sector, which has helped to drive change. And also finally, having clear and transparent communications, and I think having collective communications, for example, communications from the industry stewardship groups, from RUMA, I think that's really helped. So it means that it kind of shows to the other farmers that actually this is the industry are behind this issue, and so therefore we need to act as well. And the communications are, as well as focusing on the human health benefits, also focusing on the benefits to the farmers, you know, the benefits of having healthier livestock and better productivity. And I know that's also talked about within this this e-learning course. So that was my quick 15 minutes to talk about the UK situation, but also importantly sessions 3 and sessions 4, which are really focused on collaboration and disease prevention. So thank you
very much, Fraser, and thank you for being perfectly on time. So I'd like to invite all the participants to continue sending us the questions in the Q&A. We will have a very nice Q&A after the presentation of my colleague Alejandro Dorado Garcia, who is an animal health officer at FAO. So Alejandro, the floor is yours. You have 15 minutes.
Okay, thank you very much, Christina, for the introduction. So let me just share my screen. This one. Okay. Can you see my screen?
Yes, everything okay.
Okay, perfect. Thank you very much. So I'm going to provide a quick introduction on the role of anchor initiatives of FAO on One Health in the context of One Health, which is basically one of the aspects of the session 5 of the e-learning. So some of the aspects I'm going to introduce during the next minutes I elaborated further in the e-learning course. So just a quick overview. So I will start just with a few notes to explain why we need the One Health approach to tackle antimicrobial resistance. As some of my colleagues were saying, AMR is a natural phenomenon. It's an evolutionary process through which microorganisms adapt to different selective pressures around them, and misuse and overuse of antimicrobials increase this selective pressure, representing one of the main drivers for the emergence and dissemination of antimicrobial resistance. So these AMR microorganisms can easily spread among communities and across borders, and can also reach the general population by spilling over into agricultural products and the environment, contaminating waterways, wildlife, and soil. So given this global interconnected web of transmission, there is simply nowhere to hide from antimicrobial resistance. So that's why a multisectoral and multidisciplinary approach is recognized as critical to tackle this problem. The COVID-19 pandemic has demonstrated once more the interconnections and vulnerabilities of the different sectors and stakeholders involved in maintaining One Health security. This led the heads of FAO, OIE, UNEP, and WHO to further enhance their cross-sectoral collaboration by creating a multidisciplinary One Health high-level expert panel, the OLEP. The OLEP members represent a broad range of disciplines in science and policy-related sectors relevant to One Health from all around the world. And in its advisory role, the OLEP developed a new operational definition of what is One Health. As you can see here in the slide, it's quite a long definition, so I'm not going to go over all of it. But this definition on One Health is promoted by the 4 international organizations, and also demonstrate their commitment to work together so that we are better prepared to prevent, predict, detect, and respond to global health threats, and to promote sustainable development. For the implementation of One Health approach, multisectoral collaboration is happening at all levels, from global to local actions and commitments. So I will start with some notes at the global level. And at its annual executive meeting in March this year, the tripartite partnership for One Health, so FAO, WHO, and OIE, formally became the quadripartite, as they signed the Memorandum of Understanding with UNEP. So the 4 organizations have been working together for a long time, but in the recent years, they have strongly supported the establishment of a One Health AMR global governance structure with different governance structures through the implementation of a number of joint initiatives. And in the next slides, I'm going to elaborate a bit more on these global governance structures and initiatives. So I will start with the Global Leaders Group of Antimicrobial Resistance, or the GLG by its acronym. So the GLG consists of world leaders and experts from across sectors working together to accelerate political action on antimicrobial resistance. This group performs an independent global advisory and advocacy role and works to maintain urgency, public support, political momentum, and visibility of the antimicrobial resistance challenge. The GLG is co-chaired by the Prime Ministers of Bangladesh and Barbados and has quarterly meetings to advance in the implementation of their actions around defined priority areas of work. These areas of the defined priority areas of work include the promotion and advice for political actions, surveillance and monitoring, resource mobilization, and increased innovation, among others. So building on the momentum of increased collaboration, the quadripartite has also developed a strategic framework for collaboration in AMR. This was published a few months ago. So this framework represents the joint work of the 4 organizations, describing the comparative advantage of each of them to advance on a One Health response to antimicrobial resistance at the global, regional, and country levels. It also presents a elaborated theory of change that broadly supports the implementation of the 5 pillars of the Global Action Plan. And of course, it also strengthens the global AMR governance. And to finalize on global governance structures, the quadripartite is also facilitating a lot of work for the establishment of an AMR multi-stakeholder partnership platform, or so to mobilize resources and action. The objectives of this platform are 3. The first one is to engage all relevant stakeholders to promote a shared vision, narrative, and targets for action to tackle antimicrobial resistance. And the second one is to provide a venue for information sharing and collaboration. And the third objective is to support taking concrete actions by drawing on the advice from the global governance mechanisms and from other institutions with expertise on AMR. The type of entities that can be members of this platform can be categorized into clusters. You can see them in this slide, but these clusters include governments, civil society organizations, academic institutions, and private sectors. Action groups initiated by members and categorized into these clusters will work year-round to take specific actions that will be endorsed by the platform members at the annual plenary session. And this platform is planned to be launched late this spring, late in 2022, yes. So then continuing with the country support, in 2019, the tripartite established the AMR Multi-Partner Trust Fund, or the AMR MPTF, as a strategic initiative inviting financing partners to invest in projects to accelerate One Health implementation on AMR. So far, the MPTF is supporting 4 global projects for integrated surveillance, monitoring and evaluation, the evaluation of legal frameworks, and the role of the environment sector on AMR. The main component of the MPTF, however, is the country projects. Is the main amount of the money is going to countries and is to support a national implementation of national action plans. So far, 10 countries have already started the implementation of projects, and 4 more are currently on the pipeline to obtain funds for the One Health implementation of their NAPs. On multisectoral interagency collaboration, I would also like to mention the joint WHO and FAO work under the Codex Alimentarius Commission. So the Codex Alimentarius has developed a range of international standards and guidelines related to AMR. Some of these are the ones that are in the center of the slide: the guidelines for risk analysis, the code of practice, and the recently published guidelines on integrated monitoring and surveillance. These 3 documents directly support national efforts to minimize and contain foodborne antimicrobial resistance, while other guidelines and standards support indirectly these efforts, like, for example, the general principles of food hygiene and others that are around the main circle in the center. So during the last years, FAO has consolidated its work and to support food and agriculture sectors in the fight against antimicrobial resistance. And the role of food and agriculture sectors is crucial. We live in a changing landscape continuously. We live in a world with an ever-increasing population and a demand for food. Urbanization is also moving very fast, as well as changes in consumer habits towards high-protein diets. So this increase in demand for food is in many cases resolved by intensification of food production systems that in turn require complex livestock value chains and can also change the patterns of emergence of infectious diseases, potentially increasing the dependence of some sectors on the use of antimicrobials. So the new FAO action plan on AMR for the period 2021-2025 was approved last year with the goals of reducing the prevalence of AMR and preserving the ability to treat infections with effective and safe antimicrobials in food and agriculture production. So my colleague Jungsha and some of my colleagues were also explaining these 5 objectives of the plan. These pictures have been shown in many presentations, but these 5 objectives are in full alignment with the Global Action Plan. But if we were to group the multiple forms of support offered by the organization, by FAO, we could say that we are offering tools for capacity building, field interventions, access to technical resources and networks, and more recently, we are also developing support for data management and information systems. So I'm just going to give you a brief overview of this support. So the tools developed and deployed by the organization support the 5 objectives outlined in the action plan in different ways, as you can see in the slide. And this is also further elaborated in the e-learning course. So we would like to motivate the audience to enroll and discover it by themselves. But just to give you a brief explanation, these are tools like the Progressive Management Pathway, the PMP, to guide countries with actionable items to progress in the implementation of their national action plans, a tool called Atlas for building capacities for laboratories and surveillance systems, or for example, a methodology for the assessment of legislation in the countries, among other tools that are shown here and offered by the organization. Regarding access to technical networks, I would like to mention that in 2019, FAO initiated the establishment of a technical collaborative network of FAO reference centers on AMR. And for now, the network includes 8 institutions, including Denmark, Germany, Thailand, United States, France, Mexico, Senegal, and of course, the United Kingdom, which is also supporting highly the development of this course. Additionally, FAO also facilitates the creation of technical advisory groups for AMR and AMU surveillance in different subregions as a forum for sharing experiences and coordination of efforts in the harmonization of activities and surveillance approaches. And so far, we have basically 3 sub-regional groups in Southeast Asia, South Asia, and East Africa. So just to finish, and on the way forward, and to expand also the support offered to countries, FAO is working on a data management and information system. This year, the organization started to develop the first prototype of the international FAO antimicrobial resistance monitoring IT platform, which is called INFARM by the acronym in English. So to support, the main objective is to support countries in collecting, analyzing, and using their data on antimicrobial resistance in animals and food, and also to support the efforts for global data sharing and for integrated surveillance. So the INFARM platform will be piloted this year with a number of countries, and will include a private interface with restricted access for countries, and also a public interface that will share information generated from data of countries that want to make their information public in the public domain. So I think with this, some of these aspects are covering the learning. Some others might need to be updated because, you know, AMR is constantly changing. It's a field that is in constant change. Many things can happen in 4 months, 5 months. So this will keep being updated, but I just like to share information that is already included in the learning and also information on the way forward. So I think that's all from my side, Cristina. Thank you very much.
Thank you very much, Alejandro. And I would like to open the Q&A session. So I'd like to invite you all to have a look at the different questions that were asked, and I'm going to give you the floor now to give the answers. But before that, I would like to answer to some of the questions which were addressed to us, to the FAO Learning Academy, concerning the certification and concerning the courses. So the questions are giving me the opportunity to mention something which is important, which is that all the courses we offer and actually everything we do, the webinars, the MOOCs, the blended learning programs, the mobile programs, every single activity and capacity development interventions that we promote are all offered for free as a global public good. And our objective is universal education. So basically offering access to anyone at any time, anywhere in the world to provide them access to these resources. And we are actually trying to bridge a gap between formal and informal education. So this is exactly what we are trying to do also with our certification system. So I go back to the certification system because there have been many questions. I wanted to mention, first of all, that we are dealing with what we are offering are certificates of competences, not of completion or just that you have finished a course, but of competences. So this certificate demonstrates that you have acquired specific AMR competences. I also wanted to mention that the digital badge that you obtain after you finalize the test is not just a generic graphical element. It is linked to your name, to your metadata, what course you have finalized, what are the which date, your name, and also the specific competences you have acquired. This information is all stored within the badge itself. So it is linked to our database, and it is therefore linked to your name. So it is, and I also wanted to mention that the digital badge, as I was mentioning before, can follow you in several media and social, and also through different systems. So your e-portfolio, your CV, your LinkedIn, so you can easily attach your digital badge. But we are also right now working on a printable version of the certificate of competences. So this will also be available for those who need to have a printed version for maybe for their HR department or for their performance management. So this is also foreseen. So these were some of the information I wanted to share with you regarding the certification. And I would like now to open the floor to my different colleagues to answer some of the questions. Maybe to start, I had a question, so maybe I wanted to ask maybe our partners to give an answer. So I think we should, since WHO, IOE, and FAO are strongly advocating against the use of antibiotics, I think the alternatives should be also maybe we should raise more awareness about what are the different alternatives. In addition to, for example, I'm saying this because in addition to vaccination and also practices to avoid the spreading, I know of some farmers that are using plant-based plants which have exactly the same properties as antibiotics. So in a very natural way, they are also trying to basically cure and avoid the spreading of disease. So I just wanted to ask you also if there is the intention to try to focus. So yeah, I understand that it's extremely important to collect data. I understand it's extremely important to compare yourself with others and also to have the data to fix your targets. But I believe it's also extremely important to share the information about the concrete alternatives that there are to avoid the use of these antibiotics. So that was just a start, just to open the discussion. So maybe Fraser or Rachel or Alejandro, I don't know if somebody wants to start.
Yeah, I'm happy to come in on this one.
Yes.
You're right, actually. I mean, our focus has been more on disease prevention and on data than on looking at the alternatives. Having said that, a lot of the sectors are, within these stewardship groups, they do discuss some of the alternatives to antibiotics. And I know there are a number of alternatives that different sectors put in place, things like probiotics or acids in the water or in the food. So there are plenty of alternatives that are put in place by the different sectors, and you mentioned some herbal type things as well. I guess one of the difficulties is sometimes is the kind of clinical evidence behind some of these alternatives is not always that strong, but certainly a lot of the sectors are trying them, and but yeah, you're right, it probably hasn't been as big a focus for us as it has been on focusing on preventing disease. But it can be important. I think there's definitely a place for alternatives. I know on the e-learning it does link to the work that Europe did on the RENAFA report, where it gives quite a good overview of the different alternatives to antibiotics as well.
Excellent. We have here a number of questions by participants. Shinta Yehu So, and I think maybe either Rachel or Fraser, because I could see that the questions are more, I think, addressed towards your presentation. So maybe if you could provide some answers to these ones.
Yeah, I'm happy to step in on this one. There were some good questions actually, and they relate to the dairy, the beef, and the sheep sector. As you've probably noticed from my presentation, I'd focused more on the pig and the poultry sector because they're the sectors where we've seen the most, or where they've collected the best data, and we've seen the most dramatic kind of changes in antibiotic use, the most dramatic reductions. But however, when it comes to the cattle and sheep sectors, they are still they're very much engaged in this area. They both have their own stewardship groups, so that they call them antibiotic guardian groups. So the sheep have one called the sheep antibiotic guardian group. The cattle have one called the cattle antibiotic guardian group, and they publish targets, and they're very much focused on some of the key disease areas where antibiotics are used. They're focused on. There's been a focus on improving farmer training and making that a requirement for and some online farmer training. This is not just cattle and sheep, but across the board. There's been some farmer training developed, and there's also been a system called Farm Vet Champions, which is a vet training system as well. And I know that the cattle sector have worked hard in getting their critical antibiotic use down, and we've seen some really big reductions in the use of critical antibiotics. Where they've struggled is partly on collecting data, and there's a number of reasons for that. There's a lot more farms involved. Sometimes, especially when it comes to beef and sheep, let's say dairy. Dairy, the vets and farmers have a really good. The vets go onto the farms a lot, but I think for beef and sheep, the vet farmer relationship isn't quite as strong. I think they see themselves as a low using sector anyway, so maybe it hasn't been as much pressure on them to kind of collect this data up until now, and but yeah, so getting the data has been a challenge for a variety of reasons. We're hoping that it will improve now that we have this medicine hub that's been launched. That's is a bit like the pig sector. It's a medicine hub that's going to bring together some of the data that is already out there. And but to give you an idea, that in the latest set of targets, the dairy sector, they reckon they're going to get pretty much all their usage data by 2024. So the dairy sector are quite confident. They have good vet farmer relationships. They're collating this data already. And so I think for dairy, we'll get a really good data set. But beef and sheep, calf rearers, 50% say they're going to have their data by 2024. Whereas for beef and sheep, they've only said 10%, because I think it's more of a struggle. They're more of a it's not as consolidated. There's a lot more farms, and just bringing all this data together is a lot more challenging. But we are working hard to get it, but we haven't made it mandatory. We're still trying to work on a voluntary basis. But potentially, we'll see if we have the ability to bring in legislation to get this data if we need to, and if there's not enough progress, then it's something we will consider. So I think we're not saying we'd never bring in legislation, but would try. Our first step is to try and get work on a voluntary basis and get the data that way.
Okay, thanks a lot, Fraser. Maybe Rachel, you want to answer a few questions?
Yeah, I think just to pick up on the last question, if that's all right, Christina, also just to highlight the companion animal sector in the UK as well. That's in the UK, we have a huge sector of companion and domestic animals, and that is small animal and also equine as well. And it's very much variable on how the industry is set up and the sector functions as to how we collect that data and whether we can. In regards to kind of small animal within the UK, there's a lot of private sector, so private companies who own veterinary practices, and so we're beginning to see a trend of collection of data within those practices, and hopefully as we are able to engage with different sectors over time, perhaps looking at accessing that data and seeing what it says across the whole industry. There is ongoing efforts at the Veterinary Medicines Directorate and across government to engage with the equine sector as well. So there isn't an equivalent to rumour, as Fraser's mentioned, as far as I'm aware, but there is work ongoing to see if we can set up that engaging equine stakeholders across the industry to again collect data and analyse it, and antibiotic use and surveillance. Just because without that data we can't make evidence-based and effective policy decisions. the focus again is on voluntary engagement rather than legislation, but that could be a route that we could use in the future, and I know different countries have very different approaches on that. I'll finish there on that question. And there was a question earlier on the use of antibiotics. I'm just trying to find antibiotics to prevent secondary bacterial infections.
Yeah, that was on viral. Sorry, I answered and then it's disappeared. So
yeah, it's disappeared. That's fine. I'll try and find that in the answer section. But just I think it was an interesting question, especially to me, especially as I am a veterinary surgeon by training originally and background, and certainly that is something that we definitely see. There's definitely a focus on trying not to use antibiotics for viral diseases, but it's, I think, acknowledged that it's a lot more complicated in food producing animals, specifically if you have a viral infection initially and then an secondary bacterial infection. I think one thing I would pick up on is use of antibiotics to prevent secondary bacterial infections. So the approach that we usually would advise taking is treating secondary bacterial infections as they occur and using diagnostics, so culture and sensitivity, to identify the bacterial infection, so you can use targeted antibiotic treatment to resolve the disease process, and then other things like isolating the animal and trying to prevent the underlying viral infection happening in the future. So vaccines, use of hygiene and disinfectants, etc. But I think the key point there is that that's really difficult in some contexts to isolate animals. Culture and sensitivity may not be available always, and we can acknowledge that the gold standard approach of not using antibiotics in these instances is not always feasible or possible. So hopefully that provides an answer to that question there. There was I'll just round up on tilapia, because I think there was a question in the chat around antibiotic data in tilapia and aquaculture. That isn't my area of expertise, but certainly I work very closely with our colleagues at CFAS and Fisheries Department, and I know they have a lot of research into antibiotic use and antimicrobial resistance in tilapia populations. So you may want to check out their website. Also, they have a section under the reference centre and some of their ongoing projects, and that will give you some more information on some of their projects in tilapia. I'll hand back to you, Christina.
Thank you very much, Rachel. And maybe Alejandro, if you wanted to answer a few questions.
Yes, thank you, Christina. So actually I was typing some questions, but it's actually better to do it live. So I see one of the questions from one of the colleagues is on what FAO is doing on the issue of pesticides, and also how to reach communities with lack of internet access. So basically, in answer to this, the FAO action plan is including also for the next 5 years more support to this area of work, which is something that needs more development. There is a lot of evidence collected at the global level on the amount of pesticide use, but this is something that the organization is working on, and it's also an area where more attention will be given in the next 5 years. Regarding how to reach these communities without access to internet, basically FAO also supports governments, and through their agricultural extension officers or veterinary services, they can also reach these communities, which is basically the main role of the organization. So just to answer this question, I think very briefly, but I don't know if this is the one I was typing, so I will stop typing it. But I can look for other questions.
Yeah, meanwhile, I can also, just to add on what Alejandro is saying, in this, when we need to reach, when the target group is farmers, we absolutely need intermediaries, and usually we rely on, as Alejandro was mentioning, on extension services, extensionists, or networks of. So, for example, we work a lot with the African Forum for Advisory Services in Agriculture, or so we rely on intermediaries, and we also use programs such as the farmer field schools when we want to convey very specific messages to farmers. So these are among the strategies that we use. Please go ahead, Alejandro, if you wanted to answer other questions.
Okay, well, I see another one right after the next. So yeah, on how does FAO see the efforts translated in real world changes in attitudes and behaviors, particularly across not the agricultural sector, but across human and environmental health? And it's a very difficult question, but actually, as I was presenting in the slides, there is a lot of multisectoral collaboration going on and strengthening at the global level, but also at the ground level. And I was giving the example of the MPTF projects at country level. So these MPTF projects are actually joining the efforts of all the ministries, including environment, agriculture, but also the Ministry of Health, involving the human sector, to tackle AMR issues through the One Health approach, and tackling these cross-sectoral elements that we have to tackle. But actually, it's if we want to translate it in real world elements, I would say that I would just mention the country activity through these projects, through these MPTF projects. For example, through their integrated surveillance efforts. There is data collected in humans. There is data collected on antimicrobial resistance and use in humans, but also in animals, and especially through the support of the World Organization for Animal Health, the OIE. And then there is also the effort of FAO to produce antimicrobial resistance in animals and food. So these pieces of information on antimicrobial resistance in animals, food, humans, coming together, these are an integrated surveillance at the country level, can inform joint actions. And this is something that is happening right now in many countries that are being model countries for action on integrated surveillance, just to give an example. Yes.
Christina, if you're happy, I'll just jump in on that one as well.
Yes, please.
Carry on from Alejandro's answer.
Yes.
It was a really great question. I think there's obviously a lot of activity that is already ongoing, as Alejandro has mentioned. I think recognition of the fact that we want to see kind of actions and changes in behaviours and attitudes rather than just words. So action backing up our words. The multi-partnership stakeholder platform is undergoing a project undergoing at the FAO as well, which is engaging with key stakeholders to translate what specific actions on specific topics should we be taking on AMR, and how does that translate into action and behavioural changes on the ground. And I think so that's an ongoing intervention and project currently, and I think we'll be seeing some really exciting actions coming from that project. I think also worth mentioning is FAO behavioural change studies and the efforts within that area, focusing specifically on how human behaviour changes in terms of responsible use of antimicrobials and use in specific projects. And I think there's a lot of work in those areas as well, which highlight the change, the movement of human behaviour from overuse and inappropriate use of antimicrobials to more responsible use as well. Also, I think I just want to highlight Grace Gorman. Thank you. You've posted in the Q&A that there is a companion animal and equine rumour equivalent, which I'll post a link to the chat. So I'm really happy to be corrected on that, and I'll post that link into the chat so everyone can access it. Thank you.
Thank you, Rachel. I don't know if you wanted to answer any other questions.
Well, there's one question here talking about some of the production diseases. So it's talking about some of the viral diseases. Well, not just viral, but it does mention about bovine viral diarrhea virus in cattle and IBR in cattle, and how that there's a wide variation in the control between the different programs for those particular diseases. So yeah, they're interesting ones. I mean, they are viral diseases that can suppress the immune system and can lead to secondary bacterial infections. So I know the sectors are very interested in how they can control those viral diseases to benefit production generally, but also potentially reduce antibiotic usage. I know in the UK there's a lot of talk about BVD, and there are some kind of regional eradication schemes. Some of the different countries within the UK are carrying out eradication schemes. So I think that's the direction of travel in the UK, is to try and eradicate BVD. IBR in some other countries have eradicated IBR as well. So I think, yeah, looking at some of these key production diseases is potentially important at reducing long-term antibiotic use as well. But as it says there are some irregularities in one program, so it sounds like there is room for improvement. But, yeah.
There's also a last question from Andreas. I don't know if somebody wants to answer this one. that is just, also part of the...
I was literally just answering in the chat, but it's always best to answer live.
Yes, yes. So, yeah, this one is also challenging. Like, what are your experiences with regarding to addressing the antimicrobial resistance with the application of the One Health approach? That's the one I'm referring to.
Yeah, thank you, Christina. I think so there's going to be so many answers to this question, but I'm really happy to share my own experience. So I think I guess caveating initially is that sometimes application of One Health approach is quite context specific, and therefore the reasons why it always doesn't work are quite variable. I think in my experience, I found that sometimes competing priorities from the different angles, so human, animal health and the environment, if you have competing and diverging priorities, that is very difficult sometimes to negotiate and compromise on those priorities. Similarly, lack of trust between sectors, and I think Fraser's presentation really helped highlight that especially in the UK, we found there was a lot of blaming between the different sectors, and so bringing them together to work on a One Health project on human, animal and the environment to tackle AMR without first establishing that trust would have been probably impossible. So issues within kind of trust and finally understanding. So understanding the different the ways of working within the different sectors is sometimes, if you don't have that understanding, it's quite difficult to see where different sectors or individuals are coming from when you're implementing a One Health approach on AMR. I'd be interested to understand, Fraser and Alejandro, if your experiences on this, so I'll hand over for your answers as well.
Well, maybe Rachel, just to add a bit on this, also from I mean, because you were talking a bit more from the perspective of at the grassroots level, maybe let's say, or from the intergovernment, the cooperation between the different departments in the government, maybe, but also at the international level with international organizations, we see it's very difficult also to collaborate together, sometimes because of a lack of understanding of these different competing priorities, like Rachel was mentioning before. And of course, also there is a huge difference in terms of funding also between the different sectors that comes to tackle this problem, for example, in the food and agriculture sector as compared to the human sector. So this is also something that impacts in the way of collaboration, because sometimes the partner is expecting you to get to the same level of commitment and resources when you actually cannot reach this level. So this is also another challenge that is also happening at the country level. And it's also reflected, for example, in the national action plans. Many national action plans, most of them, they have food and agricultural components developed in them, but many of them that are not implemented because of the lack of resources, the lack of financial resources to implement these elements in the countries. So this is maybe something to add. Yeah.
Yeah, you invited me to comment. I don't have too much to add. I mean, we're working to. We have the One Health strategy, and we publish a One Health report where we bring the human and the animal sales and resistance data together to try and work out links between the two and just kind of encourage the fact that we're bringing this data together. And as I said, at a government level, we have meetings where we bring the human and the animal side together. I mean, I wonder, there probably more needs to be done to actually link the sectors together at kind of vet level. I don't know. I don't think the actual vets on the ground probably have that close links with the human sector on the ground. And I think I can't remember which country it was now, but it was a country that used some of the human health specialists to train the vets in practice on how to implement good infection prevention control, because obviously so I think they could learn from each other and better understand each other at the ground. So I think more work needs to be done there, but yeah.
Okay, thank you all. Thank you very much. And thank you also to the participants for all the questions. I just wanted to mention that the video recording, the presentations, and also all your questions and answers to your questions will be made available through the webinar section on the FAO e-learning academy. We are also gathering statistics on who has attended from where, etc. And also the statistics related to this webinar will be made available through that section. I also wanted to mention that during this session, we have also mentioned several times how it is important to analyze and to intervene in a holistic and integrated manner. And for that, you need interdisciplinary and transdisciplinary competences. And this is exactly the objective of the FAO eLearning Academy. So I'd like to invite you all to have a look, first of all, at the antimicrobial resistance course, but also at all the other courses that are related to animal health that are on the Academy, and also others that could be of interest. And I'd like to thank you all very, very much to the speakers, the participants, and our partners. Thank you very, very much. Bye-bye, everybody.